What's going on, everyone? Welcome back to another session, and in this session we're going to talk about diabetes, right? So diabetes, some of you may know, maybe not, but the clinical term for this is diabetes mellitus, right? Now we're going to go ahead and go right on into it. Diabetes is along with high cholesterol, something else that does resonate with me. As of this video, I took labs for 2 different doctors, and I'm currently in pre-diabetes stage. I'm like 0.1 percentage point over the normal limit. So, it's not that big of a deal for me, only because, I can get that level down, so it's not that big of a deal. But if you let it go on, obviously it'll just get worse. But to go over diabetes, I'll start with some general info for you. About over 34 million people are diagnosed with diabetes, and about 88 million or so are in pre-diabetes stage. Pre-diabetes can lead you to diabetes, and diabetes can lead to other chronic diseases such as hypertension, heart disease, strokes, even you can lose your vision, blindness, right, and kidney failure. Those that are in diabetic stages are 2 times more likely to have strokes and heart diseases. There are 2 different types of tests that are taken. One is your A1C test, and the other is your fasting glucose lab. So the fasting glucose test, what that does is it measures how much glucose is in your system after you've had fasted for 8 hours. So that's why, medical, professionals, doctors, right, they tell you to fast for about 8 hours when you go get labs done, because that's when they get the most accurate reading, for glucose levels. Now, I remember one time though, just to give you a little bit more info about fasting, the labs I took last year, my doctor had to remind me, 8 hours, but no more than 10 fasted. Cause I didn't plan this, right? I didn't do it on purpose. It just happened this way. I had fasted for about 12 hours. And when I mentioned that to my doctor, he was like, well, you want to be careful about fasting for too long, because what can happen is, your body will then turn to fats and convert that to glucose. So that can certainly affect your reading when you go to get a fasting glucose lab done. The other one is A1C. Now what that test measures is the percentage of glucose that's attached to your hemoglobin. So now, as a reminder, from my trace minerals video where I talked about iron, right? Your red blood cells, that's what your hemoglobin is made up of. Your red blood cells, their longevity is about 3 months. So when you take an A1C test to determine how much glucose is attached to your hemoglobin, your A1C test is sort of a collective over a 3-month period, because that's how long your hemoglobin lasts before your body regenerates new red blood cells. So that's why A1C is it's a collective, right? A1C though is definitely what's commonly used to determine where you are when it comes to diabetes. So a higher A1C, what that indicates is the higher the chances that glucose has been attached to your hemoglobin. Diabetes is the result of insufficient or ineffective insulin secretion. Now this can lead you to hyperglycemia. Now, there's hyper and then hypoglycemia. Hypoglycemia is low blood sugar, low blood glucose. And hyperglycemia is essentially elevated blood glucose. Now, when you have hyperglycemia and your blood glucose is elevated, it can destroy your blood vessels and your nerves and tissues as well. It can damage them. What happens is when you eat a meal, insulin will send a signal to your body cells to go ahead and absorb the nutrients from that said meal that you ate at that time, right? And what it does is it'll absorb the amino acids, fatty acids, and the glucose, otherwise known as fats, carbs, and proteins, in case you didn't catch it. After insulin signals your body to go ahead and absorb those energy, right? Absorb the energy from those nutrients, it will use that energy from the nutrients to maintain protein synthesis, fat synthesis, and glycogen synthesis in the liver and the muscle. So obviously without insulin, there's no glucose regulation. A lot of y'all know there are 2 types of diabetes. You have type 1 and then you have type 2. So to go into type 1, right? Type 1 is the least common case, right? It accounts for about 5 to 10% of cases. What happens with type 1 is your body, in its autoimmune state, produces antibodies against its own proteins, right? It produces antibodies against its own cells. Your pancreas is what secretes insulin. Now with type 1 diabetes, this is the type where your pancreas secretes little to no insulin. And the reason for that is because with your body being in an autoimmune state, your body has all these antibodies that's fighting against, the very cells that are there to produce insulin. So your pancreas has what's called beta cells, right? The beta cells are the workhorse of the pancreas. When your body in this autoimmune state is treating those beta cells as if it's an enemy, so your immune system is, attacking and destroying these beta cells. And as long as that's happening, there's no insulin to be produced in your body. Type 1, there are different factors from type 2. Type 1 can easily be inherited. There's genetic factors that come into play there too. So, there's other risk factors that differ from type 2. Patients who have type 1 diabetes either have to have insulin injected or they have to have an external pump in order to put insulin inside of them, essentially. It can't be taken orally because insulin in itself is a protein, and if you were to consume insulin, the enzymes in our GI tract and our gastrointestinal tract would go ahead and digest it, so it wouldn't serve a purpose at that point. The other type is, of course, type 2. Now, type 2 is the most common type of diabetes. It accounts for about 90 to 95% of cases. This one is categorized as insulin resistance, still leading you to hyperglycemia, and I'm going to explain why now. So what happens with type 2 is your adipose, which is also known as your fat cells, and your muscle cells, it's unable to, try to take glucose from the blood, right? Which is leading you to elevated blood glucose. In an effort to try to counteract that, your pancreas would try to overcorrect by having its beta cells produce large amounts of insulin. But the thing is though, with type 2, insulin resistance, what that means is your body cells essentially are desensitized to insulin. That's where insulin resistance comes into play. Your body is really just kind of essentially resisting the insulin that your pancreas is producing. This was also the type of diabetes that affects many different ethnic groups. All of these groups are, groups of color. So we have Native Americans, Mexicans, Blacks, Hispanics, Asians, and Pacific Islanders. These are the types of groups that type 2 diabetes tends to affect the most. What I have down here is another table. It represents your diagnosis, the fasting glucose, and A1C. So basically what it means is when you go get a fasting lab, these are the numbers here that your doctors and whatnot will use to determine whether you're in pre-diabetes stage or you're in diabetic stage, or if you're normal. If your fasting glucose is between 70 to 99 milligrams, you're considered normal. Between 100 to 125 milligrams, then you're considered to be in pre-diabetes stage. Over 126, you'll get diagnosed with diabetes at that point. Conversely, your A1C, less than 5.7% is known as normal. Okay, and this is what I was saying at the beginning of the video. I believe mine was at like 5.8 when I went and did my labs. I'm like just 0.1 percentage point over the normal limit. So that, of course, I can get that down because this channel is all about nutrition and fitness. I don't tell you anything that I don't do myself. I do struggle. Genetics comes as a part of that, but I do what I can by making sure I eat right and hitting the gym. So. And doing cardio, because that's a big thing, and I'll get into that over on the contributor side. But 5.7 or less is normal. 5.7 to 6.4% is considered pre-diabetes stage, and anything over 6.5%, your doctor will most likely diagnose you as being diabetic. Now, here's some contributors. Okay, for type 1, right? Basically, as I mentioned, type 1 is more autoimmune. So, any autoimmune diseases you may have or a viral infection, right, can give you type 1 diabetes. And there's other inherited factors, so genetics, right, comes into play there. Now, type 2, all right, that one is the one that is definitely preventable, okay? Type 2 diabetes, obesity, especially in the abdominal area. Okay, so if you're an obese person, you are more at risk for diabetes, for type 2. Also, aging does come into play. So, as we age, and I think I went over this briefly in my minerals and vitamins video, we got to make sure as we age, a lot of our like bones and other things like that, even our cells and whatnot, they don't reproduce at the same rate as they did when we were younger. So what that means is, we'll essentially have to ensure that we get the nutrients, right? We get our vitamins and our minerals, we make sure we got to do all of that, as we age, as we get older. With the vitamins and minerals, as you notice, as you get older, right, then, the upper limit or the normal, I should say, the recommended dietary allowance limit does increase a little bit from someone who is much younger and a little more healthy. But aging is a factor, so is physical inactivity. Okay, so physical inactivity, especially when that's coupled with, you not eating, the foods that you should be, when you're eating overconsumption of, sugars, carbs is made up of sugars. So when you're, when you're not necessarily eating the healthiest and you combine that with physical inactivity, you're definitely at risk for type 2 diabetes. Smoking is also a risk, all right, that puts you at risk. Excessive alcohol consumption is another, because a lot of people, some of y'all may know, but alcohol has calories in it. It's got so many calories. So, it's different if you're just having like maybe 1 or 2 beers versus, you having a whole bunch of beer, or you combine that with different types of liquors, right? Cocktails, margaritas, or if you're just taking straight shots. There's a lot of calories in alcohol. So, that's why I like whenever you hear the term beer belly, you can get that from excessive consumption of alcohol. And of course that beer belly, obviously can lead you to obesity, which is a direct factor for diabetes. So you just want to be careful. Everything in moderation is what I always make sure I say. Dietary habits, okay, I kind of went over that a little bit, and I'll go over more of it in the remedies too. But dietary habits, you want to make sure you're mindful of what you're consuming, all right? Chronic inflammation, if you have inflammation and you're just letting it go, you're not getting seen for it, you're not taking care of it, it could also lead you to type 2 diabetes as well. Now here's some remedies, okay, for diabetes. Now type 1, like I said, because it's an autoimmune disorder, type 1, the only real treatment as of right now is by external pump or injection of insulin. For type 2 though, type 2 can be prevented. Overall lifestyle changes is one way to do that, right? So I mentioned obesity, that's a direct cause to insulin resistance. And as a reminder, carbs. In my session 101A video, I talked about carbs, and what I talked about was how sugars make up carbs. When you consume carbs, your body converts that to glucose. So when you overconsume, that can also put you at risk for diabetes as well. That can put you in a hyperglycemic stage. You have so much elevated blood glucose, and then when you combine that with smoking or excessive consumption of alcohol, or not doing any physical activity, all of that can put you at risk. Reduce alcohol consumption, okay, that one is pretty much a given. And also try to discontinue smoking if you are a smoker. Definitely start early. That's one thing that, and as I go on in these sessions, I'll talk about prevention methods. Oftentimes prevention though, it starts in the childhood stages, right? I mean, even before that, it actually starts with, and that's why some of my videos here coming up will be targeted to a lot of my women, especially ones who are currently pregnant or are looking to get pregnant. To prevent diabetes and other chronic diseases that come with it, it starts in the womb. It starts with y'all getting the right nutrients, continuing to exercise and doing what you can while you're pregnant. There's other exercises that you can do. Pregnant women still do yoga. There's other things that you can do, that you can still go to the gym and even weight lift, provided you're not going heavy, right? I've seen all of that. So it starts in the womb, of course. But childhood obesity, with it being on the rise, that's why it's important to start early. Because diabetes, unfortunately, is starting to be seen in more and more young children. We want to make sure that we are looking into our circumstances. We're looking into what it is that we are eating, what we're purchasing, what we're putting in our kids' mouths, and of course our own too. Starting early, that's the best way to ensure that, as a kid grows from being a kid to an adult, that they also can prevent at least type 2 diabetes. All right, so before we end this video, The last thing I wanted to go ahead and show you guys was the glycemic load formula. So I'm going to show you guys how to calculate your glycemic load. It helps you keep track of whether or not a certain food that you're eating has a low, medium, or a high glycemic index. So here's the key over there in the corner. Anything less than 55 gives you a low GI. Anything from 55 to 70 is going to give you a medium GI, and anything over 70, that food has a high glycemic index. So I got my calculator handy, right? I got my nice TI 84 Plus, and the formula is right here. So glycemic value of food multiplied by the serving of carbs in grams of that food divided by 100. I don't have any meats or anything up here, just like basically size, because it's carbs, right? A lot of meats don't really have carbs like that. They're usually either higher in protein or higher in fats, depending on how processed they are. So that's why the glycemic load formula focuses mostly on foods that are higher in carbs. So that's why you don't see any meats up here or anything like that. I have white rice, most veggies, black beans, a baked potato, and a sweet potato. Here's the GI value of said food, and this is the serving of carbs in grams. And mind you, for all of these foods, we're using one serving. So obviously, when you eat a meal and you're eating more than one serving, you'll just have to adjust these numbers as necessary. So if you're eating, say, 2 servings of white rice, then that 40 is going to become 80. If you're eating 2 servings of black beans, that 22 becomes 44, because this is only based on just you having one serving. We're going to start with the white rice. We have a GI value of 87, okay? And the glycemic value is usually given to you. There's, numerous sources out there where you can find the glycemic value of a certain food. And one serving of white rice gives us 40 grams of carbs. So what you'll do is you'll take your 87, your GI value, right? And you'll multiply that by the serving of carbs and foods according to the formula. So 87 times 40, 3,480. But now you take that 3,480 and divide it by 100, it's 34.8. It's okay if you have a decimal. Usually you just round up depending on what's after the decimal. So this one is 35, right? Most veggies give you about a GI value of 20 or less. So we're just going to use 20, okay? We'll multiply that by 5, right? Because, most veggies, the 5 grams actually just comes from, I just looked at the first thing in my freezer, and broccoli, right, gives you 5 grams of carbs. So that one, 20 times 5 is 100, and 100 divided by 100 is 1. Black beans, so 30 times 22 here, you're looking at about 660. Divided by 100, that should be 6.6. Since we're rounding up, we're gonna say 7. A baked potato, 85 times 26, we have 2,210, right? And divide that by 100, that should give us 22.1, which we're just gonna round down to 22. And last but not least, we have our sweet potato, 54 times 50, and that's 2,700, divided by 100 is 27. As you can see here, right, the key up here shows you like what's low, medium, and high. Usually the starchier foods are the ones that tend to have a higher glycemic index. To share with you a little story, my grandfather on my mom's side, God rest his soul, he passed away back in 2017. And he passed away from pancreatic cancer, all the other chronic diseases that come from it. The one thing I didn't mention was cancer, because I wanted to save, this story for the end of the video. He wasn't a fat guy or anything like that. He actually was always very thin. He didn't have any muscle or anything. He was just a very skinny guy. He did smoke heavily, as well as excessively consume alcohol. Those over time, right, I'm pretty positive is what put him, it made him, put him at risk anyway. Like those are already risk factors for, your body's inability to secrete insulin and leading you to diabetes. The beta cells, right, the workhorse of the pancreas, you can imagine that, your pancreas will have some trouble. Be mindful about, the excessive consumption of alcohol. If you smoke, try to discontinue it, if you can. Physical activity is important, especially cardio. Like my doctor always tells me, increase your cardio, and I work on it. I do. That's what can happen if you're not careful about what it is that you're doing about your life. As I'm speaking about my grandfather, man, it still kind of tears me up a little bit to this day. He was an all-around great guy. I loved him to death. And there are times where I do wish I had more time with him. And maybe through this video, because like I said, my purpose is to try to help others, right? So maybe this video will inspire you all who are listening to me to reach out to family members more, even your close friends, right? Check in on everybody, right? Make sure you check in on everyone, see what's going on. Maybe if someone's eating habits or just lifestyle habits in general have changed and it's not necessarily for the better, maybe I wouldn't say pry, but just be there. Be there, show that person that you are there, if they need like a shoulder or they need somebody to talk to. And of course, my grandfather, he was born in a different time too. So, things like this, what I'm talking about now, wasn't really talked about back then. My grandfather was born in, I believe, 1941. So, these things weren't really talked about back then. All these advanced things, right? This advanced knowledge and stuff like that, I wouldn't be doing my due diligence if I didn't pass it on to everyone else as well. So, that's pretty much it though. Thank you all for tuning in. I really appreciate it. If you like this video, give it a like, give it a thumbs up, comment, subscribe if you feel inclined, and any comments, questions, or concerns, definitely hit my comment section. I do check them periodically. I think my next video is going to be about hypertension, high blood pressure. So stick around for that one. Other than that, I'll see y'all on the next one, and y'all take care.